Welcome to the South Dakota BRIN Lab Safety Training Module. Knowledge and training are essential to lab safety. In this module, we will briefly cover good laboratory practice, what to do in emergency situations, and responsible waste disposal. This module is meant to be an introduction to lab safety. Specific safety measures and practices vary from lab to lab. When you report for work, please take the time to talk to your mentor about safety issues particular to the lab in which you will be working. The lab researcher is responsible for lab safety. Safety affects you, your coworkers, your institution, and your community at large. Good laboratory practice includes correct use of protective clothing and shielding, no food or drink in the lab, proper use of hoods and biological cabinets, good record keeping and labeling of lab materials, following the protocols set up by your institution for your lab, proper waste disposal, consideration of your coworkers, and your ethical responsibility to maintain a safe working environment. Good lab practice requires you to be considerate of your fellow workers. Keep your lab clean, including your work area and the common areas. Throw away trash and wash your own dishes. Clean your equipment and return it to its proper storage place. Don't disturb your coworkers' experiments. What you may think is trash could be an important part of their experiment. Ask your mentor or coworkers for specifics about your lab. When working with others, remember the golden rule. Your mother doesn't work here. Clean up spills. Don't use the hoods as a storage cabinet. Replenish depleted lab supplies. You may have to ask about the restocking procedures, and dispose of garbage on bench tops. You are not expected to know everything the day you show up for work. Get in the habit of asking about things you don't know. Don't assume anything. Find out what you don't know, then augment your training. Formal and informal training opportunities are available in every lab in our network. And remember to put your training to work every day. When you report for work for the first time, plan to spend some time orienting yourself to the lab. Learn where the exits are, how to contact emergency services, where the fire alarm and fire extinguisher are, where the shower and eye wash stations are, and how to use them. Find out where the first aid kit is stored. You may want to open it up and see what's inside. Ask about MSDS information sheets and the procedures for hazardous materials storage. Where are the spill kits and how do you use them? And find out where your everyday safety items are: gloves, lab coats, and eye protection. Most of you have used lab coats, and protective eyewear. Remember to use them. Ask your mentor where these items are stored and how to resupply them when they are depleted. Hand washing is an underrated activity in any lab. Wash your hands often with soap and warm water. Wash them before you leave your lab and after removing gloves. Hand washing should last at least 20 seconds. Sing happy birthday to yourself twice, or sing the ABC song to pass the time. Lab bench paper is used to help absorb materials. They also act as a sponge when you spill. Place the paper on the bench, absorbent side up, and tape the paper to the bench. Always change lab bench paper immediately after a spill and dispose of the paper in the proper trash receptacle. Use dry ice and liquid nitrogen carefully. Contact with bare skin can cause burns and severe frostbite. Use carbon dioxide and nitrogen gases with adequate ventilation. Do not place dry ice in a sink, as it may damage the surface. Ask your mentor or a coworker about disposal procedures. If you have to move liquid nitrogen, use a hand truck. Store the containers in an upright position. Don't drop, tip, or roll the containers. Will you be using a sonicator in your research? Sonicators can be harmful to your hearing. You should wear over-the-ear hearing protection when using this device. When using a sonicator in your lab, make sure all persons in your lab have hearing protection and shut the door. You may also want to hang a sign warning others of the danger. Boxes are generally used for disposal of waste glass. Don't overfill the boxes. Keep the weight of the boxes to about 25 to 30 pounds. Tape the boxes securely and mark the boxes clearly as waste glass or broken glass. Sharps disposal is critical. Sharps include syringe needles, razor blades, and scalpels. Ask your mentor how and where this is done in your lab. Don't try to recap needles. Good lab results are the consequence of training, planning, and preparation. Ask your mentor or coworkers to train you when you are trying something for the first time. Get adequate training before you start. Planning is important if you want to keep Dr. Murphy out of your lab. Know your lab's plan for emergencies. In the event of an emergency, human life comes first. Don't risk your life or those of others for anything in your lab. In case of a fire or explosion, notify your authorities and coworkers. Give a vocal alarm. Shout if necessary. Call 911. If you can, try to minimize the fire's spread. Evacuate the building. This will require that you know beforehand the fire escape route for your lab. When you notify authorities, try to give as much detail as possible, including location and type of fire or ignition source. Every summer, South Dakota is subject to severe weather. Make a habit of checking the weather forecast daily. It only takes a minute and can save your life. Ask about the storm shelters in or near your lab and how to get them. Notify your lab director or mentor of your whereabouts. Chemical spills happen. Know what to do when they happen. Minimize the spill. Notify others in your work area of the spill and evacuate the area if necessary. If someone is injured, help them or get medical attention for them. Identify the spilled chemical and tell your supervisor. The two of you will make the decision to clean the spill yourselves or seek help in cleaning the spill. If you decide to attempt to clean the spill yourself, you need to consider the amount spilled, the hazards of the chemical involved, and whether or not you have the materials to clean it up. A minor spill is one that does not spread rapidly, will not endanger other people or property or the environment. This is the type of spill that you may be asked to clean. If you determine that you can safely clean the spill without emergency assistance, follow these guidelines. Wear appropriate protective clothing and equipment. Have another person stand by during the cleanup. Clean up the spill and collect all waste for proper disposal. Ventilate the area before it is reoccupied. Decontaminate reusable cleanup supplies such as scoops or rubber boots. Return the spill kit to the normal storage location. Order and restock the chemical spill kit. If you get a chemical spill on your body, go to the emergency shower in your lab. Remove the contaminated clothing and flood the exposed area for at least 15 minutes. You can also do this at a sink if you cannot locate a shower. Ask someone to call 911 for you and notify your supervisor. Chemical splashes in the eye can severely damage your vision to the point of blindness, so it is important that you know where your eye wash station is and how to use it. As with the chemical spill, have someone call 911 and notify your supervisor. You can further lab safety by minimizing the risk of chemical spills. Store chemicals on sturdy shelves. Store on shelves with lips or edges if available. Store chemicals away from the edges of shelves and counters. Use secondary containers, reduce clutter, eliminate trip hazards, and eliminate obstructions. In the case of a biological spill, there are steps you can take to minimize further contamination. Notify others in the immediate area that a spill has occurred. Allow aerosols to settle by leaving the room and closing the door. As with a chemical spill, remove contaminated garments. Wash your hands and notify your supervisor. When cleaning up a biological spill, Wait for aerosols to settle. Put on protective clothing. Apply disinfectant to the contaminated area. A 10% bleach works well. Cover the area with paper towels to absorb the disinfectant. Wipe up with the towels and mop the floor. Autoclave all contaminated wastes. You can clean low-level radioisotope spills. This slide gives the steps you will take to do that job. The first thing you should do, however, is to notify your mentor and get direction on how to proceed. If you feel unsure about how to clean up this type of spill, your mentor can direct the cleanup. A high-level radioisotope spill can be more dangerous. Minimize the spill if you can, and let others in the area know about the spill. Remove contaminated garments and gloves and wash your hands. Immediately notify your supervisor. Your supervisor will direct the decontamination, to include asking for outside assistance. Keep a record of the decontamination if you are the one to clean up the spill, and monitor the area to ensure thorough decontamination. This concludes the basic laboratory safety briefing. Remember, safe research begins with you. South Dakota BRIN would like to thank Dr. Bob Noiva for his help in crafting this presentation and his dedication to higher education.